Hello, bonjour. Je suis ici de partager l'information tellement bon pour le pays. I'm excited to announce today that the Canadian Dental Care Plan is now open for those between the age of 72 and 76, which means that all Canadians aged 72 and older are now eligible to apply for the Canadian Dental Care Program. And we can also share at this point in time that more than 400,000 Canadians have signed up. These are Canadian seniors who have signed up, and so that registration process is going to be going extremely well. I'm excited to be joined by my other colleagues who are going to be speaking to that in a little bit. But I just want to take a moment to say to Canadians as they receive this letter, as they receive their letters, wait for your letters, as Terry will say, and then register, that this is an area really essential for preventative health. When we think about oral health care, we think about having a happy smile and what that means to our self-esteem and our ability to be in the world. But we also know that it's absolutely essential in the prevention of cardiovascular disease, dementia, and other maladies, including cancer. So making sure that folks have access to strong oral health is essential, and we know that 1/3 of Canadians don't currently. So making sure that we can close that means that up to 9 million Canadians will have access to the oral health care that they need. And I'll remind folks that this is a plan with no copay for those who are earning $70,000 and under, and there are copays between $70,000 and $90,000. So we look forward to giving more updates on the program. I know there'll be a lot of questions around providers. Those details are in the final stages of being negotiated. But at this time, it's my pleasure to turn it over to my colleague, Minister Beech.
Thanks, Mark. Thank you, Mark. Hello, everyone. Bonjour à tous. It's a great pleasure to be here today to provide an update. I wanted to take a moment to remind Canadians that this is literally the largest rollout of any benefit in Canadian history. We're expecting over 9 million Canadians to be eligible. I want to thank Canadians for embracing the phased approach. So far, things are going very well and according to plan. As my colleague, the Minister of Health, just stated, I look at my dental dashboard every morning to kind of see what's going on. My latest number is 408,000. We're averaging about 20,000 new individuals that are signing up each and every day. We've had peak periods of over 30,000 people that have registered. We've sent out about half of the 4.1 million letters that we're utilizing to invite seniors as we go through these phases. A quick reminder for individuals, when you get your letter, follow the instructions that are on the letter, and I want to thank Service Canada, who took a lot of time to quality test the letters, the IVR system, the entire enrollment process to make sure that it was easy and customer focused. What you'll do is you'll call the letter, you'll need the password that is on the letter, you'll also need your SIN number. If you have any problems throughout the enrollment process, you'll actually be transferred into a call center. As of right now, we're averaging call center wait times of less than a couple of seconds. So far it's going very well. We're looking forward to having more people enroll, and we're one step closer to making sure that over 9 million Canadians have access to the dental care that they deserve. And I'll pass it on to my colleague.
Merci, Terry. Merci, Terry. Ce programme fait une énorme différence dans la vie des aînés. It's huge. This is one of the biggest improvements we've seen to the Canadian healthcare system in decades. More than 400,000 people who did not have dental coverage just 2 months ago are going to be able to see a dentist. 400,000 people will now be on a plan, the Canadian Dental Care Plan. They can book appointments to get their teeth cleaned, to have a cavity filled, to get new dentures. I have to say it's about more than just the medical coverage and dental care as well. This is substantially about dignity. It is about dignity for millions of seniors in this country. So we are starting this phased approach with seniors. Seniors 76 and up have already gotten their letters. So tomorrow, letters are going out to potentially eligible seniors aged 72 and up. Then in March, Service Canada is going to send letters to seniors aged 70 to 71, inviting them to apply. In May, an online application process will be open for all eligible seniors 65 and up. In June, it is open for seniors with a valid disability tax credit certificate and children under the age of 18, and everyone else who's eligible can apply online starting in 2025. This is going to get up to 9 million people in this country. It's going to get them the dental care that they need. Merci. Jean-Yves.
Merci et bonjour tout le monde. Aujourd'hui est une date importante, la première date à laquelle on fait le point sur les lettres qui ont été envoyées en décembre et en janvier. Il y a en tout près de 2 millions de lettres qui ont été envoyées aux aînés de 77 ans et plus. Et en date d'aujourd'hui, c'est plus de 400 000 de ces aînés qui ont reçu officiellement leur acceptation en matière d'admissibilité. Au Québec, c'est environ le tiers de ces 400 000 aînés qui ont reçu une lettre et qui ont répondu au cours des dernières semaines. Très bonne nouvelle, donc, y compris pour les aînés québécois. Et demain, bien, c'est une autre date importante. À partir de demain, à peu près 60 000 lettres vont être envoyées à des aînés de 72 à 76 ans, une tranche d'âge importante. Lorsque les aînés reçoivent cette lettre, les instructions sont simples. Il y a un numéro de téléphone que l'on utilise, il y a un code d'identification qui est indiqué sur la lettre. On donne son numéro d'assurance sociale, on répond à quelques questions assez simples et on obtient rapidement la décision d'admissibilité. Donc, une très bonne nouvelle pour tous ces aînés canadiens et québécois dans les dernières semaines. Encore de meilleures nouvelles au cours des prochaines semaines. On invite donc tout le monde qui a des questions à contacter Service Canada, qui fait un très bon travail. Vous l'avez entendu en anglais. La réponse, la rapidité de réponse est remarquable. En quelques secondes, la très grande majorité des aînés réussissent à contacter le système. Si ça ne fonctionne pas, à peu près le quart des aînés, bon, des fois ça fonctionne, mais à peu près le quart des aînés souhaitent parfois parler à quelqu'un, un agent, un vrai agent, et donc ça se fait aussi très bien. Par conséquent, on est fiers du travail que les aînés et les proches aidants et les membres de la famille ont pu faire au cours des dernières semaines pour obtenir cette admissibilité de plus de 400 000 aînés, dont le tiers au Québec. Il y a encore beaucoup de travail à faire au cours des prochaines semaines.
M. Duclos, vous dites donc 400 000 sur 2 millions de lettres, c'est juste 20 ça. Comment explique-t-on que 80 des gens qui ont reçu une lettre ne sont pas jugés admissibles? C'est parce qu'ils n'ont pas appelé ou parce que le processus est long?
Fait qu'ils n'ont pas encore appelé. Il y a évidemment un décalage entre le moment où les lettres sont reçues et le moment auquel les aînés appellent. Si on regarde à tous les jours, il y a à peu près 50 à 60 000 lettres qui sont postées et à tous les jours, il y a autour de 25 à 30 000 aînés qui appellent et qui, dans la plupart des cas, reçoivent une confirmation de leur admissibilité au programme.
Mr. Holland, we're just a few months out from this program coming into effect, and dentists still don't know how it will work, how they sign up, how much they'll be paid. How do you expect to have this program ready in a matter of months when dentists have no information at this point?
So we know how important it is to work with dental associations, and I have been engaged directly with dental associations from across the country, as have our officials, having extremely detailed meetings. And they've done a great job representing dentists across the country. We're nearing the end of those discussions. I think they've been incredibly fruitful. And at the core, we want to make sure that dentists are treated fairly, that they have they're fairly remunerated for their services, that they have clarity in terms of how that process works. And also, we want to make sure that the folks that are going in, oftentimes for the first time, there's folks who've never gone to a dentist before in their life, that process be as seamless as possible. We need to remove all barriers. So, you know, there's some difficulties and challenges in some of those conversations, but we're ready imminently to be able to share information with all providers, with all dentists, but it was really important that we work through those issues with the associations over the last little while, and we'll be able to talk about the fruits of those negotiations very soon.
Où est-ce que vous en êtes dans les négociations avec Québec pour une compensation? Ça a l'air de staller, excuse my language.
Ouais, non, alors j'avais eu une chance de parler avec le ministre Dubé et c'est clair que l'idée que chaque personne partout au pays, le Québécois, le Québécoise, oui, mais le Canadien quand même, peut accéder le soin de dentaire. Ça, c'est l'enjeu. Et on est prêt de travailler avec les provinces de Québec et c'est clair qu'il y a des enjeux sur les questions de juridiction, mais c'est pour quelque chose aussi important que le soin de dentaire. C'est important de travailler ensemble pour trouver la solution.
Qu'est-ce qui bloque? Est-ce que vous exigez d'élargir l'offre de soins dentaires? Vous
Oui.
refusez de donner l'argent sans condition?
Non, alors pour nous, on a un système, on est prêt pour chaque personne partout au pays de recevoir les soins de dentaire. Et c'est important de ne bloquer pas ça. Et alors, s'il y a des questions avec Québec sur les systèmes d'administration ou qui est responsable pour un aspect ou d'autre, on peut travailler ensemble sur ça. Je pense que ce n'est pas important pour les personnes qui ont besoin d'aide.
Mais en quoi est-ce que le Québec le bloque?
Oui, mais c'est une question de si le Québec veut administrer le programme ou veut être responsable pour le programme, ça c'est une option peut-être. Mais pour nous, mais c'est la qualité du programme, l'équilibration du programme partout au pays, de s'assurer que chaque personne va recevoir la même qualité de service et dans le même programme. Ça, c'est essentiel pour nous parce que c'est la question ici et le soin dentaire. Et ça, c'est essentiel pour la santé généralement.
Why wait till 2025 to expand eligibility to adults who aren't covered under these other categories when the supply and confidence deal calls for those folks to be covered by 2025, not in 2025, and it would mean pausing enrollment after the summer?
Well, first of all, I want to thank the New Democratic Party, in particular my opportunity to work with Don Davies and before me, Jean-Yves Duclos. They've been a good partner. This is not easy stuff to work through. This is an enormously complicated program. We're talking about 9 million Canadians. And so it takes time to metabolize that and to be able to get everybody registered and be able to roll out those services. We're working with dental professionals and we're working with our own administration and with Sun Life, who's the provider, to do this as fast as we possibly can. And every day we add somebody who gets dental care that they didn't get before, that's a material improvement over where we were before. So would I like to get there tomorrow? Yes, but we're, physics and the laws of gravity and reality constrain us. And so our ambition has to be constrained with getting it right. And what you will have heard is that the wait times for people to get enrolled are it's almost instantaneous. You pick up the phone and you can get enrolled. We want this process to be as seamless as possible. Again, this is an important aspect because a lot of the people we're talking about have never had access to oral health care. Many of them may have never seen a healthcare professional in their life. So this is a significant barrier to get them there. So we have to make sure, as much as we possibly can, that we get it right and that they have a positive experience.
Even that once this opens up, can you guarantee that all of these seniors who are now applying will have a dentist to go and get this care?
Well, what I can say is where we are right now is roughly 300,000 seniors do not have access to dental care. I cannot promise it will be perfect as we roll this out. I don't have that power. I don't own that magic wand. None of us do. But what I can say is that every day we expand the cohorts. Every senior that we get to see an oral health professional is a material improvement on where we were. And we cannot allow perfection be the enemy of progress here. There are 9 million Canadians who don't have access to oral health care. That is not only a fundamental issue of social justice and about them feeling good as they walk around in the world, it is fundamental to their health and to prevention that we get that right. And that means that there are going to be times I'm out here and there's going to be things that aren't working exactly as we want it to. That's the nature of rolling out the largest program in Canadian history. But you have 4 people here who are committed with all of our being, along with the New Democrats who are our partners, as long with Sun Life, as long with the administration and Health Canada, Service Canada, and the other departments to get it right.
Parce que vous parlez d'accès aux soins. Il y a la dernière clinique privée d'avortement au Nouveau-Brunswick qui vient de fermer ses portes. Est-ce qu'il y a quelque chose que vous pouvez faire? Est-ce que vous pouvez pénaliser le Nouveau-Brunswick? C'est quoi vos options? Où vous en êtes là-dessus?
Oui, alors, sur les questions d'avortement, c'est essentiel que le service est disponible. Ça, c'est un droit fondamental pour les femmes partout au pays. Alors, c'est pas acceptable, pas du tout, de fermer une clinique ou d'avoir une situation comme ça. Ça menace la santé pour les femmes et c'est pas acceptable. Alors, on doit prendre un petit moment pour évaluer la situation et je vais parler bientôt avec notre réaction.
Est-ce que retenir du financement, c'est une option?
Oui,
pour
oui,
vous?
alors il y a beaucoup d'options, mais maintenant, je dois comprendre qu'est-ce que c'est le problème actuellement et je dois parler avec mon homologue dans la province et je connais M. Fitch tellement bien. Alors, c'est important d'avoir une conversation sur ça, de comprendre bien la position de la province sur ces questions-là et je peux répondre plus que ça avant ça.
Mais vous l'avez fait dans le passé, retenir des fonds. Donc, je veux juste comprendre c'est quoi l'hésitation. What could be a caveat this time that wasn't last time? That means that this time you don't take back the funds.
We're talking now about the evaluative services? Yeah, I mean, look, it is essential that our public health care system be public and that folks not be charged. And when provinces engage in or allow private clinics to charge patients, this is a threat to our public health care system. And but what I can say though, is the conversations that I've had with my provincial and territorial counterparts have been extremely productive, and that there is an opportunity where we've withheld funds from the Canada Health as a result of violations of the Canada Health Act, that we can give back that money as long as they meet the conditions of ensuring. Well, the only hesitation is that there's an agreement to comply with the Canada Health Act, and there's an agreement to make sure that the people who were charged were reimbursed. If that occurs, then there can be a reversal of that. Now, in the next coming days, I think I'll be in a position where, as I have conversations with my counterparts, those conversations, I have to say, are going very well. They've been incredibly positive. I think these are things that will be remediated. But those are, ongoing conversations that will be concluded in the next coming days.
Un droit de retrait avec pleine compensation.
Je pense que la question, premièrement, est de s'assurer que chaque personne, chaque Québécois et Québécois, peut recevoir les soins de dentaire. Et je comprends bien qu'on doit travailler ensemble avec un esprit de coopération. Et c'est tout le temps le cas qu'il y a des problèmes de juridiction. Pour les personnes dans les rues, les personnes veulent le service. Et pour moi, ça c'est l'esprit, quand je parlais avec M. Dubé. Et je suis certain, avec cet esprit-là, qu'on peut trouver une solution.
Mr. Holland, on your party's fundraising numbers, your party is getting completely decimated by the Conservatives in fundraising quarter after quarter. They've now more than doubled you, their biggest margin yet, as with Justin Trudeau as your leader. How are you going to be able to mount an effective counterattack as you have promised this year against Pierre Poilievre? There's no ad campaign yet from your party, and you're lagging significantly, not just in the polls now, but also in fundraising.
Well, look, it's a great time to sow fear and division, and there's a lot of profit in it. There's a lot of fear in the world. We're in a time that is immensely divisive, where people have been subject not only to a pandemic, but global economic uncertainty and global wars, and holding a mirror to people's anger and just making them more worked up, pushing into their wounds, into their fear, has great profit in it. And the Conservatives have been enormously successful in exploiting that. But what have they offered in way of solutions? Nothing. Look, it's just let me say exactly what we are doing, and today is a great example of it. We're standing up and putting up our hands and saying we're going to try to make things better. In this extremely difficult world, we're going to do something as hard as the four of us are here today to talk about, to launch dental care for 9 million Canadians. That we're doing everything we can to make sure that we build the houses and have the health care and have the affordability that Canadians need in a world that right now is extremely difficult. And this is not the first time the world has gone. And there were the prognosticators of doom. You know, if you go to the early 80s, the people who said the great times of humanity were done. People like Poilievre parading around and saying that, well, sure, but the question is, we did not lose the cause. That at the end of the day, the people who prognosticate doom, I do not think is what Canadians want. That there is no solution in that. Saying that things are broken.
million does not indicate Canadians
No,
are
I think that we have a lot
supporting
of,
them.
I think we have a lot of work to do. But I'm saying that, look, I'll put it this way. I'm a parent. Many of you are parents. It's easy to be the fun parent. It's easy to tell your kids what they want to hear. It's easy to go take them and do fun things and tell them all their problems aren't their fault and that they're, it's very hard to be the one that says, this is a tough time. I'm going to lean in with you. You're going through something hard. Let's find solutions. I'm going to be the bad guy and tell you things sometimes that are hard. I'm going to be honest with you about what the facts are, right? It's tough to put up your hand and take responsibility. It's tough to stand here and say we're going to deliver dental care for 9 million people. It's tough to take on an international crisis like we're facing in Ukraine and like we're facing in the Middle East, and to stand up and say we're going to try and we're going to take responsibility. It's easy, just to finish the thought, it is very easy to take the other side and say in tough times, yeah, everything you say, everything you're angry about, I'm just going to agree with you and make you more angry. It fixes nothing. So yes, it's a harder route. It's a harder route to plow, to be responsible, to put up your hand, to try to make things better. But the only thing we've heard from the Conservatives is anger, division, amplification of people's fears. I don't think that's what people want to hear. And we have over the next 2 years, and that's what we're focused on, getting things done. That's our focus.
Last year, Minister Lametti said the provinces were very close on MAID and he just needed another year. How close would you characterize the provinces to actual readiness on being able to move forward on this?
Unfortunately, due to parliamentary privilege, I can't comment even beyond the comments I made yesterday. So once parliamentary privilege is lifted, I can speak further on MAID, but at this time I can't speak to MAID.
Can I ask you, Mr. Beech?
Yeah, sorry, go ahead. Mr. Beech.
Mr. Beech, you're a minister in a new position that we don't know much about. I was just wondering, you were talking about your dental dashboard. What's your role in all this? What do you do?
Yeah, well, just in dental or overall?
Well, dental.
Oh, well, it's the best softball question of my life, so thank you for that. So Citizen Services, a brand new ministry. The way that I would define it very easily is I think about it as dental, digital, and customer service. And dental is actually code for dental and benefits provision as well. Dental, as we are talking about today, is the largest benefit ever rolled out in the history of Canada, but I'm also responsible for the other benefits that are being delivered. So if you look at OAS, GIS, CPP, EI, that's over 39% of our budget. I'm also responsible for Service Canada and the 32,000 employees that work there. And recently, the CDS, the Canadian Digital Service, is also transferred from the Treasury Board to the Minister of Citizen Services under ESDC. With regards to digital, it is my role to try and provide better customer service by providing 365-day-a-year, 24-hour, 7-day services that haven't been available previously. I talked in the House about moving towards online passport renewals as an example. This isn't a secret, we had a backlog of over 350,000 passports last year. Now that backlog has been completely eliminated, but I want to make sure, as we're approaching peak times, as we are right now, that we're working to eliminate those lines by allowing people not to have to stand in line at all.
These things have been transferred from their former department to whatever department you're...
The Minister of Citizen Services, yes,
okay.
that's right. And so if you look at the things that are being provided under the benefit scale, the things that are being provided by Service Canada, and then you look at where the government is going with regards to utilizing digital services and a digital-first posture to be able to provide better services to people living in rural communities, to take people out of lines, to make sure that interactions with government is easy and simpler than it's been in the past. That is exactly what I'm driving towards. So I'm going to be talking to you guys about how we're going to reduce lines. I'm going to be talking about how we're going to use technology to make lives easier for Canadians and to make sure that services that Canadians expect the Government of Canada to provide are being done on an easier way that is focused on the customer and making it easier for Canadians than necessarily easier for government. I hope that was a reasonable summary.
Mr. Holland, can I just revisit? I just want to clarify what you're saying. Are you saying that Canadians just don't understand how good they have it under your government and
No,
that they're
not
being
at all.
spoiled children?
Not at all, not at all. What I'm saying is that these are some of the most difficult times that people have ever lived through. I know myself, I've never lived through harder times, and that when I'm having conversations with people that I love, we're all afraid for the world. And that in that time of fear, just as in every other time of fear in the world, that it is easy to speak and amplify that fear. It is hard to look into the unknown and to say with belief and conviction that we will, as we have before, overcome the challenges that are before us. And we do that by holding together, by not amplifying fear and division, by not pushing into vulnerability, but by having honest conversations and lifting each other up. So the analogy, well, it's related to fundraising because, look, if you're willing to go and just say what people want to hear, and the Conservatives are feeding into people's anger, right, about the world. I'm angry about the world right now. Sure.
I hear what you're saying, but
Yeah.
at some point, the popular parents gets more hugs. Like, I hear what you're saying, you disagree with it, but they do have more money.
I
So
have-
how do you respond to that, and is it a concern that less
Sure.
people want to give you money?
But I think that the end of the day, you know, you go back to why you ran. And I didn't run to, in a moment where things are tough, just, you know, throw up our hands and say things are broken and say, isn't it all awful? That's not why I ran for office. You know, and frankly, I didn't run for office so that I could win. I ran because I wanted to make a difference. That's why we all did. And so doing the hard thing and putting up your hand and taking responsibility and trying to bring people together and trying to find solutions, it's the harder path. But I believe this fundamentally, that when Canadians sit in their at their kitchen table and they evaluate what is a collection of talking points that has no substance, that has absolutely no plan for the country, that when rubber hits the road, and I see it in Durham, right? We've got a by-election coming up in Durham, and there's an opportunity to really talk to people about solutions, right? Not just about in a moment of time, are we frustrated with what's happening with the world, but really about what do we do about it, right? I get it. When something's gone wrong in my life, and goodness knows things have gone really wrong at different moments in my life, there's moments where I wanted to be angry and, you know, give up. But that isn't what ultimately succeeds, and it's certainly not what drives us. And so I believe when rubber hits the road, when Canadians evaluate who stood up, who tried to bring people together, who tried to find solutions, and who is just amplifying anger, that one is missed and it'll be blown away, and the other will be revealed as dawn breaks, that there are people who are really trying to make things better and lean into hard things. And I think this example here, dental care, is a real and tangible example of exactly that.
How do you raise more money then? Money is the lifeblood of politics.
Sure.
You guys know that. So how are you going to raise more money?
I believe in Malcolm Gladwell's The Tipping Point. If you want to know my personal belief, it's that you want to have inch by inch, conversation by conversation, real conversations with people. Hear them where they are. Hear how they're hurting. Explain what you're trying to do. Don't, you know, look, we can't beat Polyev on slogans because, you know, you can't put in 100 words the solutions that are facing the country. And so, you know, for sure, he can win on just coming up and saying, oh, we're going to fix everything by waving a magic wand, right? That's happened all throughout history. And for brief moments, when people who are prognosticators of doom and sell overly simplistic snake oil solutions, right, they can be successful for a moment when people are scared. But there's that moment where you step back and you take a real hard evaluation of what's happening in the planet. You know, when somebody says, oh, well, you're saying Canadians never had it so good, why don't you put it another way? Who has it better? What country would we trade places with right now? Which country would we wish we were instead of Canada? Now, that doesn't mean that it's fantastic to be alive right now. It's hard. But who would we trade with? And if you have a hard time answering that question, it's a darn important question. And they don't want you to ask that question. They want you to look down at the moment we're in and not the world we're in. They want you to give up. They want to say it's broken. Well, if Canada is broken, then what is not broken? I believe in this world. I believe in standing up and doing hard things and fighting. I think we have to do that. And I think today is an example of that. And, you know, and you ask, well, how do you make money off of that? I think that's the wrong question. The right question is, how do you fight for what you believe in? And that's what I'm trying to do.
Wrong question, because you need money in order to run campaigns.